100,000. Steve Kornacki, good to have you back. Steve, I was just saying, I think you're one of the smartest guys, so I would like you to tell me not what you see in the polling data, but what you see in the CDC's data. How do you describe this virus to someone who just beamed aboard from the Starship Enterprise?
It spread really quickly. It is heavily concentrated in the New York metro area and a few other metro areas. It has the potential, it seems, to spread to a lot of other places. But right now, after I'd say 6 weeks of pretty intense social distancing, and really 2 months of pretty intense social distancing, it looks like that cliche we kept hearing about flattening the curve. That seems to be, when I look at the individual state data, in a lot of places, that seems to be what we're seeing. So it has horrible potential. It's done horrible things, but maybe about 2 months in here, we've gotten to a place where we were talking about getting 2 months ago.
Now, Steve Kornacki, if data was food, you would be a super chef. You would be on the cooking channel with your own restaurant, cooking up the data. When you look at the data about the disease, how do you describe the disease and the people it attacks?
Yeah, and I think I heard you talking about this a few minutes ago. It looks like it can, right, from everything I can see the data, it can affect anybody, but it looks disproportionately. The older you get, and the more you have, I think you were talking about, you say, if you have obesity, other sort of comorbidities, it looks like any kind of, if your breathing is compromised in any way, it looks like statistically, it just looks like you have a lot more to worry about if you get this. Anybody who gets it, I mean, I'm 40 years old. If I got it, I'd be very nervous. But I could also recognize the numbers tell me I have a far better chance of getting through it and maybe getting through it without much issue than somebody 40 years older than me.
We had a renal specialist call in earlier, quote, when you get it, you're really rolling the dice. And I have been using the analogy of a gunshot wound. We have about 100,000 gunshot wounds a year. Nobody wants a gunshot wound, right? It may not kill you, but it's going to hurt. And 30,000 plus of those people die. It is really bad to be shot by a gun. And if you have obesity, hypertension, or any of the other underlying comorbidities like asthma, you really don't want to get this. But I think we need to start talking about is who is safe. We know kids are safe, right, Steve Kornacki?
Yeah, I did see there was it's funny, I reached out to somebody and I haven't heard back yet. I saw that study that came out, I think, of England saying that they didn't have any records yet of a kid giving it to a parent. And I've seen a few cases, and I say a few, I mean like two that I found, so it's more anecdotal, of children under 12. But basically, yeah, statistically, you don't see kids popping up with this at all. It really just, and as I understand it, and it's been explained to me by the experts, it's kind of the opposite of what you see with a lot of these viruses, where it can be pretty widespread with kids in other cases. But here, yeah, statistically, it's barely a blip. It's not even a blip, I'd say.
Because what I'm working towards is your opinion of the following. Ought we to open the country to under 40-year-olds? Ought we to say to them, you might get a flu-like virus, very low likelihood, but you can go back to the restaurants. But if you're over 50, stay home. And if you're over 70, really stay home. You think that's where we're headed?
I wonder. I feel right now, my sense of it is the news you got last week about remdesivir, the optimistic things, and I take it with a giant grain of salt, but the optimistic things that you've heard from the folks working on that vaccine in the human trial stage over in Oxford, I wonder if we have a few months here before we get to what you're saying, where maybe we can make some really quick and impressive strides on the treatment front and get this into a position where, I've heard Scott Gottlieb talk about this, where when the fall rolls around, we have 3, 4, 5 different treatments we can throw at this. And the whole picture we're just talking about in the last few minutes looks different, because anybody who's 50, 60, 70, overweight, hypertension, whatever, who comes down with this suddenly has more than a fighting chance because we've got some treatments.
That is the good news for the people who are most vulnerable. I'm looking, though, to try and get the economy going back.
Yeah.
To say to people, all right, we've crunched, this is really a Fauci or a Birx question. We've crunched the data, and we think your odds of getting really sick to the point of death or even in ICU are very, very low if you're under, say, 45. So go for it. Now, that is not, by the way, they've lost a sailor on the TR. Most sailors are not old, and most sailors are not health compromised. So it's clearly not always the case. But you also die in car crashes. And if we can get an idea of who is safe as opposed to who is vulnerable, I think that people like you, data crunchers, have got to start telling us this. I mean, how much time are you spending, Steve, studying this data as opposed to, say, polling data?
Yeah, no, the polling data has been pretty flat lately. I've been looking more at this, and I've approached it as obviously I'm a layman. My background is not medical, is not epidemiological at all. I have been studying up as much as I can, and I think the vast majority of people looking at this outside of the medical professionals, folks in the news business are kind of laymen like me, and I think we're asking the same questions you're asking. I think that the concern that I've heard with what you just kind of proposed. I guess what I hear is the potential for not necessarily. You can separate somebody who's 80, 85 years old. You could say let's keep them sort of isolated here. But what if you're a 35-year-old and you go to the grocery store, you go to your office, whatever, you pick it up, you're asymptomatic, you don't know you have it, and you're visiting with your seemingly healthy 58-year-old parent, and turns out they can't handle it that well. Are you going to see a lot of that? And the other issue too that I'm interested in here, just in terms of the data, is the prevalence of this. And I think we're starting right now to have widespread antibody testing. I think that's the other issue too for getting back to normal. It sounds like if you can get to a point, New York City might be closer to this than anybody else. They've had estimates here that 20%, 25% of the population of New York City may already have antibodies to this. It's spread that quickly here. I think if you can get a handle on the antibody situation, you potentially be talking about the issue there of, hey, if you've had this, if you've gone through it, if you have the antibodies, are you good to go? I think that's a question that might be coming up.
You're right. You're right. I had a great doctor on Friday say, I need incidence and prevalence data, and it's not anywhere. And his frustration was, I need to know where it is and how often it is and who's getting it so that I can study and give advice. That's what I'm looking for, is pattern recognition so that we can take pattern recognition and craft public policy from it. And it seems to me that the extremes have won. Now, here's a difficult question. You understand sunk costs. Um, the country has enormous sunk costs in the shutdown. Do you think those sunk costs could possibly paralyze our public health authorities from giving us clarity and not consciously, not that they're hiding something, but there are enormous sunk costs here, and we know what the dangers of those are.
Mm-hmm. Yeah, I wouldn't feel comfortable suggesting that, but I hear what you're saying, and I think I more broadly, I have been frustrated that it feels like a lot of the debate around this is either you're all for opening everything up or you're all for keeping everything closed until we can get a vaccine or treatment. And I think my sense is, and I'm looking for polling on this, I haven't seen it yet, but I'm looking for good polling on this that gets to the middle ground on that, because I suspect that's where a lot of people are. I suspect that's where a lot of people are going just because of the circumstances of their own life. Everybody has to think about the dwindling bank account, the unemployment, or whatever the worry is. I suspect more and more people are thinking of that middle ground and how to come up with some kind of means for themselves and for our society to survive until you can get to a place where you have a vaccine and we can just get this behind us.
When I look at those 45 days, Steve Kornacki, the 15 days to slow the spread originally, and then 30 days to slow the spread, 45 days total. To me, it was about building ICU capacity and hospital capacity, but now it's also about building a database so that public health officials can say, do this, do that, with some decent reliability. And one of the things they're going to have to say, it's going to be tough, but they're going to have to say, if you are over 65 and you have hypertension, you have to stay home. Because, my gosh, it's 57% mortality for people with hypertension who get this virus, for whatever combination of science. We've got to get that specific. Do you see anyone talking that way yet?
Not yet. I haven't. I'm starting to see the numbers get assembled like you are. I think we're getting more out there every day. I think another one, the doctor you were mentioning there, is it's the prevalence of this. How many people have this asymptomatically? How many people have had this asymptomatically and just never knew it? And we're going to find out when we get really widespread testing of people who've never had symptoms. And then when you get that number too, how easy is it for them to transmit it? I mean, we've got all these folks
Yep.
going into grocery stores with gloves on now. Is that something we got to keep doing, or is that an overrate? I think we need some more data on that front too.
Last question, Steve. As I've only asked you about the disease because I know your ability with numbers, even if you're a layman. I'm curious, what percentage of time on air are you using crunching the COVID numbers versus crunching the polling data? Because I think your value is so much higher on the former because the latter is going to change so dramatically in the next 6 months.
I think that's it. I'd say right now I'm 2/3 on the coronavirus. 1/3. I mean, I've got that big board where I do election results. We're tracking cases, we're tracking curves, we're tracking death rates. We're not tracking poll numbers as much in there anymore.
Are they doing that on a regular? When can I find Kornacki on NBC or MSNBC? Where's the regular Kornacki on COVID? Because I actually think I'd watch that every day.
It's honestly, you got to have it on all day because it might be in the 1 o'clock, it might be in the 3 o'clock. I'll pop up here and there depending on the day and depending on the topic. I can tell you that the next 2 nights, Monday, Tuesday, I'm going to be hosting the 7 p.m. hour, so you can.
I will,
you
but
can get a little bit there.
Go see Andy Lack and tell him Hewitt wants Kornacki on COVID on a YouTube channel. All right?
I'm going to pass that along.
Kornacki on COVID on a YouTube channel. I'll watch it every day. I trust you with the data. Steve Kornacki, always a pleasure. Follow him at Steve Kornacki.